Good morning. We have 10 o'clock, so we're going to go ahead and get our webinar going. I want to welcome you to this morning's webinar being hosted by the Ohio LTAP Center in conjunction with our partners. Of course, Ohio LTAP is hosted at the Ohio Department of Transportation, and we also have a partnership with the Ohio Department of Health and with Tool Design Group, who is going to be your presenter this morning via Michael Blau. So we have a webinar for you on land use and health fundamentals, and Michael is going to be your presenter on the webinar this morning. But before we get started with Michael's presentation, I do want to go over a few housekeeping items. One of them is that we do have everyone coming in a muted mode, and we do this to cut down on the background noise during the webinar. But we encourage questions, and the way you can pose questions during the webinar is through the chat pod, which hopefully you can see on the bottom left-hand side of your screen. Now, if you're not seeing it already, then there should be a circle there with a thought bubble in the chat, or in that area of your screen, bottom left-hand side. Just click on that, and then your chat pod should open on the left-hand side of your screen. So that's where we ask that you please pose your questions. I will read those questions off to your presenter, and that way we can get responses to your questions while the presentation is occurring. Now, at the end of the presentation, as long as we have sufficient time, we will go ahead and open the phone line up for audio questions. One last thing I want to mention is that we are attempting to record the webinar. Hopefully we will be successful, and if we are, we will post that on our YouTube site and send a link out to everyone. But if we're not, at least you're here and you're going to be able to partake in this webinar in an interactive mode. So we're glad you've joined us this morning. And Michael, are you all ready?
Yeah, I'm ready to go. Can you hear me okay?
Awesome. Sure can. All right, it's all yours. Thanks.
Okay, thanks a lot, Victoria. We're really grateful to ODOT for hosting this, and it's definitely a great example of state agencies working together, so I'm happy to be a part of that as well. So as Victoria mentioned, this is a partnership between Tool Design, the Ohio Department of Health, and ODOT, who is hosting our webinar. Just want to go over a couple of things before we start the presentation. I'll do introductions for myself and talk a little bit about upcoming events, and then we'll get into land use fundamentals, talking about the intersection of land use and health, and delve into some more detail looking at specific land use and environmental design strategies to improve health outcomes. Then we'll talk about some implementation strategies and action steps that you can take in your community, and then we will discuss equity considerations at the end. And I'm hoping we'll have about 10 minutes for Q&A at the end of this. We're also going to have a handful of interactive polls during the presentation to help guide the conversation, and we'll be able to see those results in real time and talk about them. So please have your phones ready to respond to those. I'll give you more instructions when we get to that point. And Victoria, that might be a good time if anyone has questions in the chat box to bring those up while we're waiting for the results to come in.
Oh yeah, absolutely. And there actually was one question already from Heather, and it's more of a technical question, but it says, should I see any slides yet? Heather, yes, you should be seeing slides. So if you're not, why don't you go out of the webinar room and come back in, and hopefully that'll refresh everything on your screen for you. I think we're good now, Michael. Thanks.
All right. So once again, my name is Michael Blau. I'm a project planner at Tool Design Group, and my role on this project is to manage our active living services contract with the Ohio Department of Health. And that involves a lot of stakeholder engagement and on-the-ground activities with all of Ohio's Creating Healthy Communities coordinators. We lead a lot of trainings and workshops and town halls. We provide technical assistance on active living and active transportation topics to all of the CHC coordinators in Ohio. And we also produce a lot of resources and other materials related to active living and active transportation, and I'll share those with you in a moment. I primarily focus on active transportation in my role at Tool Design, but I do have some public health experience. I worked at Columbus Public Health as an intern for several years, where I supported the Healthy Places coordinator, and I developed a health and equity and transportation training for ODOT's Active Transportation Academy last year. Just want to acknowledge that the Centers for Disease Control and Prevention provide funding and support for this program. So I want to thank them and acknowledge their contributions, specifically the Division of Nutrition, Physical Activity, and Obesity. All right, we have a lot of upcoming events related to our land use and health series. We have 2 more webinars coming up. The first one on May 22nd, we'll take a deeper dive into land use and health challenges in small towns and rural areas. The second one on June 13th will focus on how land use related health challenges occur in urban contexts. Today we'll talk a little bit about different challenges in different types of communities and as well as shared problems across urban and suburban and rural areas. But the next 2 webinars will go into a lot more detail. And Victoria, you can correct me if I'm wrong, but I think you can register for those on LTAP's webpage, and if not, they should be up fairly soon.
Yeah, there's a link that will be going out later today with registration information for both those webinars that I'm going to send to everybody who was registered for this webinar.
Okay, great. So this series of webinars is really a preview for a series of land use and health workshops that are open to the public that we'll be hosting around the state. We're really excited to lead these workshops as part of our contract with ODH, and we've partnered with planning organizations, regional planning organizations across the state to bring these workshops to local communities. It's open to the public. Anyone is welcome to attend. I would especially encourage you to attend if you're a health professional and you want to learn more about how land use and health connect. It would be a great idea if you could bring a local planner or a transportation professional or a decision maker from your community who deals with land use issues on a regular basis. These workshops are really going to be an opportunity for you to start building those cross-sector relationships between land use and health professionals. Our first one is going to be in Independence outside Cleveland on May 14th, and our second one will be in Dayton on June 19th. And we are finalizing dates for future workshops right now, but those will occur all over the state throughout the summer. As I mentioned, we're developing some resources for ODH related to land use and health, and we'll be releasing this report on best practices in land use and health in the next month or so. CHC coordinators, you all will receive a copy of this at your April meeting in Columbus, and others who are listening, you can find this report on the CHC website in the coming months. It talks about a lot of the same content we'll discuss today around Land Use 101. It also goes into more detail with a set of Ohio case studies that highlights specific communities that have effectively used land use strategies to improve health and communities who have those strong cross-sector partnerships between land use and health professionals. All right, so we're going to do our first poll to get things started. First question is, what is your experience with land use? So if everyone could please take out your phones, go to menti.com, menti.com, and use the code 64456. So I'm going to go over to the website now, and we can see the results coming in. So again, what is your experience with land use? And then once you select your answer, remember to hit submit at the bottom of the screen. I'll take a couple minutes to let people fill in their answers. All right, so it looks like there might still be some answers coming in, but as you can see, it looks like a lot of people on the line have a basic understanding of land use, and then there's a handful of small groups who are more familiar with it and some who are less familiar with the term. So that's a good cross-section of understanding about land use today. I'm going to go back to the presentation so we keep moving along. So we're going to talk about land use and health 101 issues before we delve into more detail. The way that land use and transportation as well shape our built environment is really closely linked to health outcomes. And over the past decade or so, there's been an increasing acknowledgement of that and more emphasis on the links between transportation and land use and health, especially at the federal level from agencies like the CDC and the USDOT. More and more grant funding is focusing on the intersection of these issues. So to start out with, what is land use? Land use is the practice of how communities manage and modify their physical space. Not only does it regulate our built environment, which is our buildings, our roads, and other infrastructure, it also shapes our natural environment. It can be used to protect wildlife areas and wetlands. It can determine the location and type and intensity of different agricultural uses. And it can also reserve spaces for parks and trails and other recreational uses. So it's really a comprehensive tool to help manage a community's change and ensure economic, social, and environmental strength. Land use can determine a lot of different activities, such as where we live, where we work, where we play, how those activities best fit into a community. And it can also go into much more detail and determine how specific sites and buildings are configured and laid out. For example, a zoning code could require sidewalk-oriented building entrances to encourage pedestrian activity instead of a building entrance that faces a parking lot. On the other hand, a zoning code could also require parking maximums, meaning that you have to provide a certain number of parking spaces based on the type and intensity of land use on a particular site. And that leads to huge parking lots and encourages more automobile use. So we'll talk more about that later, but that gives you an idea of the power of land use and how it really shapes our daily habits and preferences, especially in how we travel and how we interact with the built environment. In Ohio, land use is the responsibility of local governments. So that is village, township, city, or county governments. And land use decisions often occur with extensive public involvement. That usually happens as part of a comprehensive planning process or a comp plan update. Comp plans guide all aspects of a community's change, and land use is a really important part of that process. So we've talked a little bit about land use and have a basic understanding. Let's talk about how it connects specifically to public health. It's really an important tool for local governments to shape public health outcomes. It shapes how we live, how we travel, how we access particular destinations. And to give you a concrete example, let's talk about how I might get to my grocery store. If I have a grocery store down the street from my home, and just so you all know, this is my neighborhood in Columbus, and I know that my grocery store has an entrance that's accessible from the sidewalk. It has secured bike parking out front. It's connected to the sidewalk network and a larger active transportation network, so I know I can reach it safely and comfortably. I'm a lot more likely to bike or walk there than I am to drive, and I'll gain the health benefits that are associated with increased physical activity. But most importantly, my local land use and zoning regulations in Columbus allow commercial uses like grocery stores right next to residential uses like my house, which is what allows me to live near that grocery store in the first place and make that a walkable or bikeable trip. Now, let's say I live in MacArthur, Ohio, which until recently did not have a grocery store at all. Residents had to drive 30 minutes one way to the Walmart in Jackson to access fresh foods. And having been to a Walmart, I can tell you that I'm sure it has plenty of parking spaces, multiple driveway entrances, probably has a drive-through pharmacy, maybe it has curbside grocery pickup. All of these site design details and services make it more likely that I'm going to drive there, as well as the long distance between where I live and where the store is. So that encourages auto-dependent sedentary lifestyles and negative health outcomes. And that just gives you an idea of how land use and zoning regulations can really shape all these details of a particular destination or a site, as well as where that site is allowed to be in relation to where I live. Land use, in addition to physical health, it can also affect environmental health. What we call noxious land uses refer to things like landfills and heavy industrial sites that produce hazardous materials or contaminate their surroundings. And I hesitate to say this because ODOT is graciously hosting our webinar, but highways, unfortunately, can also be a noxious land use in a lot of circumstances. They create a lot of adverse air quality, noise, traffic safety issues, and other problems for communities that are directly adjacent to them. So those are some general connections between land use and health. And now we're going to talk a little bit about health issues in different land use contexts. Planners love to use this graphic to illustrate all the different types of built environments that we live in. It's called the transect, and it's divided into separate zones that range from the ones on the right, urban centers and urban cores, so our downtowns, all the way to natural and rural zones on the left. We're not going to get into quite that much detail today. Instead, we're going to talk about land use and health in three broad contexts. The first one is urban, and those are large or medium-sized cities. They typically have a fine-grained mix of land uses throughout their neighborhoods. They were often developed when cars were less common and have more of a compact layout, at least in their downtowns and inner ring neighborhoods. And then we have suburban areas. These are our communities outside our large and medium-sized cities. They have more of a low-density layout, more of a disconnected street system that separates uses and prioritizes long-distance car trips, which tends to discourage active transportation. And then finally, we have small town and rural contexts. These are really two different types of areas. Small towns in Ohio typically have compact town centers and main streets that are very walkable and human-scaled, as opposed to auto-oriented. But once we move beyond these small town centers, we find spread out, more isolated developments with a lot of open space between them, which means that a lot of these developments are more dependent on cars. So as you might imagine, each one of these different land use contexts has a distinct set of health challenges. There is some overlap in certain categories, as you can see, but there are also a lot of health challenges that are unique to certain types of communities. This is included in that best practices report, and I won't go into too much detail, but I'll just pull out a few examples from the list here. So the second one, loss of farmland and local food production, is really unique to suburban communities. That happens when what we call greenfield development, which is building on previously undeveloped land, encroaches on existing farmland or agricultural uses, and that reduces the supply of locally available fresh food. Poor air quality is another one that's shared between urban and suburban communities, and that really is due to traffic and other noxious land uses, especially near large highways, that contribute to that poor air quality. Going down the list, you can see lack of physical activity is a shared problem across all these different types of communities, and that's due primarily to, a number of factors, but mostly an auto-oriented layout. And I know I mentioned that urban communities are typically more compact and walkable, but of course, that's not true in all cases, and a lot of cities do have, wide districts and neighborhoods where they have a lot of auto-oriented development. Columbus is a great example. It has a lot of low-density parts throughout the city that are not very walkable. And then we'll just talk about one more. Social isolation is a common issue in suburban and to a lesser extent small town and rural areas. And that's really due to low density layouts, single family housing, and more of an auto-dependent lifestyle, which means less opportunity for interaction. So if you have long distances between where people live and centers of social activity and community activity, that can lead to isolation, and it can also create mental health challenges. All right, we're going to do another poll. I just want to get a feel for what type of communities our audience lives in. So I'll go back to Mentimeter and go to the next question. So if you could pull out your phones again and refresh the screen, you should see this next question. What type of community do you live in? We'll give it a few minutes for people to answer. And if there are any other questions, we can take those now as well.
No other questions other than someone who was having network issues and said that the presentation had been interrupted and wanted to know if it was still going. So if you do have that happen, okay, I recommend that you log out of the presentation and come back in, and hopefully that'll reestablish the connections for you and get you a fresh screen to see the presentation that Michael's got for us.
All right, thanks for handling all the technical issues, Victoria. It looks like most people have answered this question. So I would say a plurality of our audience lives in the suburbs. About 47% of our audience lives in the suburbs. And If that's the case, you'd think that we might be able to predict what type of health challenges you all are dealing with in your communities based on that graphic I showed you. So we talked about social isolation, loss of farmland for food production, and other challenges that are unique to suburban areas. So let's see if that pans out and how accurate that graphic is. And I know I'm leading the audience right now, but please respond faithfully to what types of problems you all are dealing with in your communities. So if you refresh your screen, you should see this next question: what health challenges does your community face? I'll give you another minute or so to answer this question. And you can pick as many responses as you want. Wow, look at all those dots. All right, it looks like answers are still coming in, but we'll go ahead and try to dissect these responses. So we have a lot of people who are dealing with pedestrian and bicyclist safety issues. Looks like a lot of people who are dealing with increased risk of chronic disease, lack of physical activity, healthy food access, traffic injuries and fatalities. Looks like fewer people have challenges around poor water quality and limited access to green space. Those are less of an issue, as well as loss of farmland and local food production. So maybe our graphic is not entirely accurate for every community, but it does generally apply to most situations. So this is really informative and helpful to know, and I think this can help guide our conversation later on. It looks like pedestrian and bicyclist safety is our winner here in terms of the most common challenge that our audience faces. And that's good because we're going to talk about that in terms of how active transportation can improve public health.
There is one comment that came into the chat pod. It says, how do you not have issues with water quality in your communities?
Is that a question to the audience or a question to me? Because I would agree that a lot of communities do have water quality issues, especially in urban and suburban areas where there's a lot of impervious surface area, which means a lot of parking lots and roads and concrete and pavement that creates runoff and pollution in our natural water systems. So that is an issue that a lot of communities face. It might be an issue that people are not as aware of or something that they're not necessarily focusing on.
Yeah, the person did put another comment in. It says, just a thought, between the algae blooms, CSOS, lead in pipes, climate change. So it looks like it was more of a rhetorical type question that they were just posing in general. Another comment that came in said it may be that the audience is more focused on transportation and food access and chronic disease. I think air and water quality are issues universally, and another person agreed. And I would have to agree with you too, Michael. I actually live next to a lake here in Ohio, and we can't even swim in it in the summer because of the runoff from the farm fields and the fertilizer. Sure. And another person said many rural areas utilize well water, which at times sees fewer water quality issues than city-hosted water sources. There you go.
Yeah, I think a lot of communities deal with water quality issues, and of course the exact problem is going to depend on the type of community. In rural areas, that can be problems with septic systems contaminating groundwater and things like that, whereas in urban areas it might be more associated with things like lead pipes, and that can lead to severe health challenges. I think we could probably have an entire webinar series just on water and air quality and the health challenges related to that. So those are all good points, and I'm glad people brought those up. We're going to move on, and we've talked about the challenges that everyone's facing in terms of land use and health. So let's talk a little bit about tools we can use to impact public health with land use. There are 4 broad categories that we're going to talk about, and then I'll get into a little more detail later on. So the first one is to design to increase physical activity. And that means that, by encouraging physical activity, we make it safe, easy, and comfortable to walk or bike for both recreation and transportation. And that means that we're biking or walking to work, to school, to run errands, various other types of trips. We're not just biking to get exercise out on the trail. And it's been shown that increased levels of physical activity, like when I walk or bike to my grocery store, can reduce the risk of chronic disease, meaning things like obesity, cardiovascular disease, diabetes, and other common diseases that we face. So by shaping our environment to encourage more active transportation, we can have a significant impact on public health outcomes. The next strategy is to design for mental health, and this really focuses on connecting people to nature, to parks and recreation centers and other community facilities. And it's been shown that when you have more access to nature and increased social interaction around these types of activities, that can improve mental health. So we can also target design strategies with specific populations in mind. If we customize those first two strategies to address the needs of children, then we're creating safe places to play and get physical activity, and that can improve both physical and mental health for children. This could take on a number of different forms. It could be something like calming traffic on residential streets where children are likely to play, so creating safe spaces for them to play. It could be connecting schools and residential neighborhoods to parks and recreation facilities so that children are able to access those facilities. And we know that children who have these assets and resources have faster physical and mental development and better health outcomes as adults. And then the last strategy here is to design for environmental justice. And we often use euphemistic language when we talk about groups that have been hurt by land use decisions. For example, underserved, marginalized, disadvantaged populations. These are terms that you can see on the slide here and that I've used in the presentation. And I just want to be clear that these groups are almost always people of color and low-income individuals, and there's a lot of significant overlap between those two groups. Noxious land uses, like I mentioned earlier, highways and landfills and industrial sites, those types of uses disproportionately impact these groups. So representatives of communities of color and low-income communities should always be included in land use decisions, especially ones that affect them. And we'll talk more about this towards the end of the presentation about some specific strategies we can use to address this issue. All right, we're going to delve into more detail now and talk about specific land use and environmental design strategies that we can use to improve health outcomes. There are two approaches that go hand in hand when we're talking about improving community health through land use. The first one is improving what the CDC calls pedestrian or bicycle transportation systems, which is also known as active transportation networks. And the second one is what we're going to focus on today, land use and environmental design. And we'll go through all of these 4 strategies right now. So when talking about land use and environmental design that support active living, everyday destinations is the preferred language that the CDC uses. It's pretty simple and concise and easy to understand. It resonates with a lot of different health and planning and other professionals. So what does it actually mean? It just means that everyday destinations are places where people can access daily needs by foot, by bike, or by transit. And that first strategy under everyday destinations is proximity to destinations. So placing daily needs where people can reach them by foot or bike, such as grocery stores, schools, job centers, medical centers, parks, and many other examples that we could talk about. And making those trips to these destinations useful, safe, comfortable, and interesting. Jeff Speck is an urbanist and city planner, and he has written extensively on how to make our cities and communities more walkable. And these are his 4 tenets of walkability that he's identified. A walk must be useful, so you can run errands, you can walk to school, you can walk to work. It must be safe. We must have infrastructure in place that protects pedestrians from vehicles, and we also have to create a safe environment in general for pedestrians. It must be comfortable. The built environment along the road should be pedestrian scaled and oriented, so we're not walking along a 6-lane road next to massive parking lots on one side. And then it should be interesting. Sorry, it should be interesting. There are things to look at. There are storefronts, public art, other people. There is vibrant street life that is engaging and enticing and really makes people want to get out and walk to their destinations. The next strategy is mixed-use development. Traditional zoning tends to emphasize separation of land uses, and mixed-use development takes a different approach. It encourages a blend of uses in the same district or the same property. So housing and commercial activities that are within the same site or even in the same building are an example of mixed-use development. And when we mix uses like that, it allows more trips to be completed by foot or by bike. This type of development is usually in more high-density urban areas where space is more valuable, although it's definitely an effective tool to create more walkable places in suburban and small town settings as well. There's several different land uses visible in this example here, so let's go through these. We have parks and green space in the foreground, and then we have commercial uses, so restaurants and shops, and on top of that we have residential uses. So that's our vertical mixed use example, which is housing over shops. So just in this one scene, we can identify 3 different types of land uses, and you can see just how much physical activity and social interaction that is generating. So that's a really powerful tool. Our next strategy is residential density. Placing homes closer together can create more compact communities, and that reduces the distance that people need to make their trips. So it makes communities more walkable and more bikeable. And I should just explain that density is a term that measures the intensity of a particular type of land use. So single-family housing would be low density, whereas apartments or townhomes would be more high density. And while we typically might expect to see high density development in urban areas, it works in suburban and rural settings as well. This is an example from New Albany, which is a suburb of Columbus, and it has emphasized walkability and compact development in some of its neighborhoods, as you can see from the sidewalks here and the apartment buildings as well. And then this example from Fostoria shows a medium density townhome development with access to transit. So density can work in a lot of different situations. We just have to have the right regulations in place to encourage it and willing development partners. And we'll talk more about how to create that situation in a little bit. A lot of communities, especially suburban communities, only allow single family homes in certain districts, and that makes those communities spread out or low density, meaning that fewer people can walk and bike, and that encourages sedentary lifestyles. It also means that communities are more exclusive and homogeneous in terms of race and income. So the type of development that I showed from New Albany is sometimes called missing middle housing because it fills a hole in the density spectrum between single family housing and more high density multifamily apartments. All of these examples here are types of missing middle housing, accessory apartments, duplexes, townhomes, cottages. This type of housing can really fill in a gap and create enough density in residential neighborhoods to support transit and local businesses and other destinations, which makes it more walkable and bikeable. And then our last strategy under everyday destinations is parks and recreational facilities. Ensuring that parks and rec facilities are accessible to residents of all socioeconomic levels and connecting these destinations to neighborhoods by active transportation networks. So I recently worked on a project in a community whose YMCA moved out of the downtown and to the edge of the city. It's not accessible by sidewalk, there are no bike facilities connected to it, and no transit. It's a great community asset. A lot of people use the YMCA there, but they have to drive to get there. We are working in that community on trying to expand active transportation facilities to connect the Y to the rest of town, but the better option would really be to keep it downtown or near where people live. So citing parks and rec facilities in places that are not as accessible to all modes of travel is a disincentive for people using them. Ideally, we would want to see those destinations within walking or biking distance or within residential areas themselves. All right, we're going to talk about some implementation strategies now. So these are really concrete actions that you can take to start improving health outcomes in your community, and they go hand in hand with some of the concepts we just discussed, but they give you some more actionable items that you can think about in your own communities. The first one is create incentives for healthy development. Local governments, as I just mentioned, might be tempted to site certain amenities outside of developed areas or on the edge of town because land is cheaper. And from a financial perspective, that might make sense for local governments, but they also need to consider the long-term health costs that they are potentially burdening their residents with by not offering walkable and bikeable destinations. And again, this goes back to my YMCA example. So what we refer to as civic uses, which are parks, schools, libraries, rec centers, and other hubs of social activity, those should be within walkable and bikeable areas. And if we encourage that, those types of investments can really create opportunities to improve existing transportation networks, filling in sidewalk gaps, expanding transit service, and serving existing communities that might be in need. Focusing tax subsidies, special financing, streamlined permitting, and other development regulation tools to encourage developers to build and compact more established areas is part of this strategy. And this kind of development can also serve as a potential anchor for more investment in those neighborhoods. Another strategy is to create a land use plan that prioritizes physical activity. Local municipalities in Ohio control zoning, development and design review, parking codes, open space requirements, and a number of other regulatory tools that can shape our built environment. And these can also be used to create better public health outcomes for our residents and visitors. So I have a few examples here that I'll go through briefly. The first one is reducing or eliminating building setbacks. And a setback is the distance between a building entrance and the road on which it faces. And if we have commercial setbacks that allow for parking to be placed in front of buildings, that can degrade the street character. It can create less pleasant walking environments so that we're not fulfilling those 4 tenets of walkability that I mentioned earlier. And it can also introduce more conflicts between motorists and other users. This is an example from the Grandview area in Columbus, where for some reason a Giant Eagle Market District was allowed to locate their brand new store almost 500 feet back from the public right-of-way. And this shifts all of the activity that this site is trying to generate with their outdoor seating, their cafe and bar and other activity. It shifts all that activity to the parking lot, and it creates dead space or auto-oriented space along the road here. So that's really a lost opportunity. And if communities discard these setback requirements and encourage that parking is placed in the back instead of in the front, that can really transform what a community looks like. This is another example from Bexley, which is a suburb of Columbus. And as you can see here, they flipped the site layout so that the parking is in the back and the building is in the front. And that really creates more inviting storefronts. It activates street level activity and pedestrian oriented activity along the sidewalks here and can really create a more walkable environment. Another example is parking maximums. So a lot of communities have minimum parking requirements, and that means that they mandate large parking lots for certain types of uses, which, as we just saw from that last example, consumes a lot of land, creates low density development, and discourages walking and street level activity. Some communities have taken a different approach and are now adopting parking maximums. And that really represents a strong shift in priority from vehicles to people walking and biking. So parking maximums cap the number of parking spaces that are allowed in certain zoning districts. And that's a pretty big step, but even if you don't take that step, communities should still consider updating their parking codes to be more pedestrian friendly, adding sidewalks through parking lots, adding clear and direct connections from the street through a parking lot to the front door, and even lowering some of those minimum parking requirements. And then the last example here is removing single-family zoning districts. This doesn't mean that we're tearing down existing single-family housing. It just means that we're allowing other types of housing, like multifamily dwelling units and some of those other missing middle housing types that I mentioned, in all different types of neighborhoods. And that does a few things. It combats displacement of low-income people and community of color in neighborhoods that are redeveloping. It also eliminates single-family, eliminating single-family zoning also allows for more accessory dwelling units to help build density in these neighborhoods, and that allows for more services within walking and biking distance. So that's a really transformative and important strategy that communities can consider. And then the other general strategy that I wanted to discuss is building relationships with different sectors. And as I mentioned at the beginning, this is really what our series of land use and health workshops are designed to do. All of these different community members and decision makers should be at the table when we're discussing land use and health issues. And then focusing specifically on relationships between land use and health professionals, there are a few things that we can focus on here. We want to meet the other side where they are and find common ground. So what that means is that there are a lot of shared outcomes and shared goals that land use and health professionals can agree on. We just need to find what those are and sort of familiarize yourself with how the other side speaks. So familiarize yourself with land use terminology and health terminology depending on what your profession is. Make sure you're starting from square one when you're talking to others and explaining terms that might be unfamiliar to them. On a related note, land use and economic development are driven by money. So framing your collaboration pitch to demonstrate the cost savings and the economic benefits of public health improvements could be a successful strategy. And then become an expert that they trust and that they can rely upon. Land use and public health are both very data-driven fields. So if you can use your data to legitimize your views and your expertise, as well as considering qualitative data as well from community members and other residents who have important lived experiences that can inform your decisions, can help you build those cross-sector relationships. I'm not going to go through this slide, but I think that we can send the presentation out later. These just give a few more resources of land use and design strategies to improve health outcomes. And again, if this webinar is being recorded, we can share this out later. So before we end, I wanted to talk about equity considerations. And this is a really important note to end on because the strategies that I've been talking about, they seek to improve health outcomes via design and built environment changes. And generally, that's a community benefit. However, a lot of these strategies often result in displacement and marginalization of people of color, low-income people, and other underserved groups. And I'll give you another example that we've been talking about this whole time, this idea of compact mixed-use development, which is good because it encourages walking and biking and it improves health outcomes, but it also tends to push out existing residents from revitalizing neighborhoods due to higher rents and increased police presence and other factors. So same idea, introducing bicycle lanes and other active transportation facilities is often used as a deliberate tool to attract young, white, wealthy residents to gentrify neglected neighborhoods and encourage redevelopment. So we see a shift in users of who's using active transportation and what types of destinations they're trying to get to. And that's really detrimental to all of the community. So we really need to be proactive and mindful and transparent during redevelopment and as neighborhood demographics shift and change. And there are a couple of general things we can do to achieve that. What does an equitable approach look like when it comes to land use and health strategies? So I don't think that we should discard all the strategies that I just discussed because of the risks they entail. I think instead we should use them and modify them as needed to serve those community members with the greatest need. Here are a few examples. Requiring affordable housing units in new developments, giving priority to existing residents for new housing, and other types of inclusionary zoning practices can help offset some of that potential displacement that we see when redevelopment occurs. Community-led planning means working with marginalized groups to, for example, design active transportation facilities that meet their needs and can make roadway improvements work for everyone, not just for newcomers. And then inclusive public engagement really means bringing public engagement to underserved communities rather than expecting them to come to a public meeting at City Hall. So using small events, having tables and interactive displays at farmers markets and festivals and other community events to gain feedback on what residents want is an example of inclusive public engagement. And in some cases, it might make sense to pay residents for their time to participate in these engagement activities, offer gift cards, food, childcare, other incentives to help residents participate in the planning process and make sure that their opinions and priorities are being heard. So each of the strategies in this report and this presentation should be adapted to improve the health and the welfare of underserved neighborhoods while also uplifting community health as a whole. And with that, I have one more question I want to ask you all before we open it up to Q&A. It looks like we have about 15 minutes, which is great. So the last question is, what immediate action can you take to improve health via land use strategies? And I'll go back to Mentimeter so we can see the results come in. This is an open-ended question. So go ahead and type your response in, take a minute or two to think about it, and then we'll see what people say.
While Michael's administering this question through Menti, I will remind you that if you have other questions you'd like to ask him, please feel free to enter those in the chat pod, the bottom left-hand side of your screen. And if you can't see the chat pod, there should be a circle there with a thought bubble in it that you can press in order to display the chat pod.
Thanks, Victoria. And while these answers are coming in, I can give another minute or two to have people submit their responses. Could we go ahead and unmute the lines so that people can share their responses if they want and ask any other questions about the presentation?
You got it. I'll start working on the line and unmuting people. So if you have a party going on in the background, make sure you tell them to calm down or quiet it down so it doesn't disrupt the presentation. And there is one question that did come in the chat pod. It says, we have already seen a shift of hospitals in central Ohio move from the urban areas to suburban areas, making them less accessible by walking, biking, or transit. What strategy can we use to incentivize hospitals to remain in the urban areas and accessible to the economically disadvantaged?
Wow, that's a great question and a very complex issue. So I know that that is definitely a problem in Central Ohio. I think one example that the person is probably thinking of is Mount Carmel moving out of Franklinton and really keeping just sort of a bare bones facility in Franklinton, which is a low income and minority neighborhood in Central Columbus.
Just a reminder, I'm unmuting people, so please make sure you hold down on the background noise.
I like Al's wife real well. I've never met her. She's sweet.
I think I found the person who's talking, Michael. Sorry.
That's okay. I think that some of those development incentives can be used to encourage institutions like healthcare facilities to locate or stay in downtown. I know that it's sort of a slippery slope, offering different types of economic incentives for businesses and institutions to stay in downtown, and we don't want to have all of our tax revenue going to support these types of institutions. But partnering with them and sort of keeping those relationships and partnerships open between local government officials and hospitals and other institutions to make sure that they understand the value they're providing to their communities by staying in these central locations and serving underserved and disadvantaged communities, I think is a start. And it's also, it's really a case-by-case basis. I'm not sure exactly what the decision process was in Mount Carmel leaving Franklinton. So I think it sort of depends on the scenario.
There's no other questions in the chat pod, but I'm working my way down the list. Somebody did say that there's similar issues in the Cleveland area in regards to the hospital situation. But if you have an audio question you'd like to ask, please, or a comment you'd like to add, please go ahead and feel free to chime in. I'm all the way up to the L's now, so I'll be finished unmuting everybody here shortly.
Okay, thanks, Victoria. There are also a lot of good responses coming in on Mentimeter, as you all can see. So if anyone sees the response on the screen and want to share a little more, that would be great. For example, public sector investment in low-income neighborhoods achieved through community organizing. If the person who wrote that wants to elaborate, please feel free to share. Engaging community members through every step of the process is another good one. I see a lot of strategies focused on active transportation, better walking and biking connections.
There was a question that came in wanting to know if the responses could be shared at a later date.
Yeah, so if this is being recorded, you should be able to see this later on once Victoria posts it on ODOT's YouTube channel. And I think I can also export and share the results with everyone as well.
That'd be great. I'd be happy to send those out with the hopeful follow-up link for the recording when we're done.
So again, I see a lot of ideas around active transportation, especially in rural and suburban areas. If anyone who submitted those responses wants to elaborate and share a little more, that would be great.
And Michael, I'm curious if we have anyone on here from the Montgomery County or Dayton area that might be able to share some of the strategies they're using to reinvigorate the west side of Dayton with the, I know that there was a feature actually on ProPublica on PBS that featured that area of the state with the unfortunate situation there with the opioid epidemic, but it sounds like a lot of the strategies that you're talking about are some that they're using to employ, and they talked about it in the episode, as far as combating the food deserts and looking at making things much more walkable and the integrated land uses. There's another question that came in. It says, how have you or others created a priority for existing residents and new housing developments?
Sorry, could you say that one more time?
Sure. How have you or others created a priority for existing residents and new housing developments?
So that's a good question. And that's often difficult to achieve, especially if you have developer partners who are not willing or don't understand the value of doing something like that. So I really think that the most effective strategy is to require that in your zoning practices. And that goes back to this idea of inclusionary zoning. It's a bit of a controversial idea because some people think that it can actually increase market rate housing prices as a whole throughout the community. But I think studies have shown and research shows that it does benefit low-income individuals and people of color who have been longtime residents in these communities that are being redeveloped. So again, examples of inclusionary housing practices means that local governments are requiring developers to reserve a certain number of their units for low-income individuals or keep those units as affordable housing units. It could be prioritizing individuals who already live in the community, prioritizing their applications to live in new developments. So those are just a couple of examples. I'm not sure if that answers the question, but if anyone has a follow-up question, we can keep talking about that too. And to answer your question, Victoria, we do have a CHC coordinator in Montgomery County. I'm not sure if they're on the line, but if so, I'm sure they could probably elaborate on your story about Dayton.
Well, if they're on the line, they're unmuted, so they can feel free to talk. Your comments are still rolling in, but it sounds like people are kind of hesitant to take up the offer of the audio conversation here. So
Sure.
Here we go, another one that came in. It says, it seems as if a key issue is the perception of how lifting zoning restrictions can help improve health and quality of life. For example, a local corner store, bar, or multifamily units in a single-family residential neighborhood. Do you have thoughts on how this public perception issue can be addressed? And after you respond to that, there is another question for you too.
So just to make sure I understand, the public perception issue of this type of sort of mixed-use development going in as a possible, something that's possibly negative for certain people? Is that
Right.
what the
It's
question?
how do you get the zoning restriction lifted in order to get the mixed use into what would have been traditionally single-family residential neighborhoods?
Okay, I understand. So there are a few different mechanisms we can use. Some of those I already discussed. Another idea is instead of altering the zoning code itself, we can add what's called a zoning overlay district. So that's adding additional regulations, or it could also be easing regulations in a certain area on top of the existing zoning. So let's say, for example, that I want to add more of that missing middle housing, so accessory dwelling units, townhomes, cottages, to densify a neighborhood in my community. Instead of changing the zoning in that neighborhood from single family to multifamily, I can lobby my planning commission to put an overlay district on top of that single family neighborhood, which would allow for more multifamily, medium and high density housing. So that's an example where we don't necessarily have to change the zoning code, but we can add additional regulations on top of it to encourage the type of development that we want to see.
Great. And then the next question is, what do you do when there is not zoning in a community? How do you control new development? And then I do have another question for you after that.
That is a great question. And I would be interested to hear more if that person wants to speak up and share more detail about what they're talking about. I would guess that it's probably more of a rural community. And in
Michael?
that case, I think that, yeah.
This is Jenny from Perry County.
Hi, Jenny.
And that was my question. And we do have 3 communities and 3 townships that are zoned, but the majority of our county is not zoned. And I've only worked in one community that's not zoned. And luckily, they have taken control to try to revitalize their community. But I just don't know how you can really control people from coming in and starting up whatever they want.
Yeah, I think that sounds like a potentially dangerous situation if you have an unzoned area that could see some of those noxious land uses like landfills or industrial sites that might locate there. If the local governing body has no zoning authority, they wouldn't necessarily be able to stop a use like that from coming in. Likewise, if they want to potentially add more density to some of these small towns or more isolated developments, just to make those areas more walkable or bikeable, again, they wouldn't have the zoning authority to do that if people would prefer to just build single-family homes. So I think that without zoning authority, you really have to rely on those cross-sector partnerships and personal relationships between local officials and health professionals and developers and community residents to figure out what type of development the community wants to see.
Okay, thank you.
But I would say that having that zoning authority is a really important tool.
Jenny, there's also another response in the chat pod for your question from David.
Thank you.
So, And then, Mike, I want to circle back real quick before I read the other questions in the chat pod, because there was a comment from Eric who posed the question about the lifting the zoning restrictions, and he did give a further clarification that said that his question was actually more about the NIMBYism, the not in my backyardism.
Okay, so the NIMBYism refers to people, for example, maybe in single-family neighborhoods who hear about an apartment development going in or a mixed-use site, and they might be worried about more traffic, more parking issues, more disruptive behavior. And it could also refer to something like an industrial site going in nearby that people don't want to see. So I think that sometimes NIMBYism can be warranted if there's a really particularly noxious site that is being proposed, but a lot of the times I think it has to do with people's preconceived notions about certain types of development. So for example, if people hear that an apartment building is going in, they may think that that unit is catering to low-income people, people of color, people that they may not necessarily want to see in their neighborhood. And that goes back to this idea of gentrification and displacement and zoning that creates homogeneous and exclusive communities. So generally, I would say that I'm not incredibly sympathetic to people who don't want to see those types of developments and uses in their communities, because I really think that speaks to people's idea of creating an exclusive community. And to overcome that resistance, again, going back to those personal relationships, trying to work with health and land use and transportation professionals to make sure that local decision makers and officials are on the same page and that they understand that densifying is an important tool of creating more diverse and welcoming and inclusive communities. I think that's a great start if you can have all of your local officials on the same page and hopefully have more constructive conversations with some of the community members who are resistant to that.
And there's the other question I was going to bring up, and I do want to acknowledge that it is 11 o'clock, so if anyone needs to leave us now, we completely understand. But there was a question, and then there was a response comment that I'll read off too. It says, is there a role for the state and for the federal government in promoting development from a public health point of view, like the ones discussed today? And then the comment that came in response to that was, I don't think any of these goals, notions can be achieved without government engagement, particularly if we are talking about making improvements for communities that have been left out. And then they wanted to know, what does everybody else think about it? So Michael, there you go.
Sure. So Ryan, if you want to jump on and answer this question too, please feel free to. But I think that our partnership with the Ohio Department of Health and the Ohio Department of Transportation is a great example of how state agencies can really affect local health outcomes by providing these types of materials and resources and convening land use and health professionals in situations like the series of workshops that we're leading. I think that state agencies can really play an important role, not only in terms of funding these types of activities, but also creating space for this type of dialogue. And if anyone from ODOT or ODH has other ideas to that question, please feel free to answer.
Yeah, this is Ryan Volrath. I am the Healthy Places Coordinator for the Ohio Department of Health's Creating Healthy Communities program, and I also manage our statewide physical activity and nutrition physical activity grant component. And it's a bit interesting because the state and federal government, we can promote these strategies all the time, and I will continue to do so, but at least in Ohio, land use is something that is going to always be handled at the local level. So I think the number one role that at least we're trying to play right now is education and advocacy, and letting people at the local level know what is possible, and then leaving that decision in the hands of folks at the local level. And that's why we're doing webinars like this, and we're hosting the statewide workshops as well.
Okay, gentlemen, you've done a great job with the presentation today, Michael and Ryan. We appreciate your response on that question. Just as being respectful of our participants' time, we are at 3 after 11, so I'm going to have to go ahead and wrap things up. But this has been an excellent webinar, and we definitely encourage you, when the information is sent out later today, to please look at registering for the 2 future webinars that are coming up. And thank you all for participating. We appreciate the dialogue, and we encourage you to continue all of your efforts in this area to help us have safer and healthier communities. Thank you, everyone.